Hi, everybody, and thank you to another episode of MedTech by Medical Tourism, where I have as my guest Dr. Selva, who has his practice all the way in Malaysia and has over 30 years of experience. And we're going to talk about fibroids and the way to treat them and that new technology that they're using in some places in Europe and in Latin America that's called HIFU. Hi, doctor. How are you?
I'm fine. Thank you for inviting me to this video podcast.
Thank you so much for accepting our invitation. We really wanted to talk to you because you have a lot of experience in this matter. And we've been hearing a lot of high frequency ultrasound to treating different types of myomas, cancer, and other uses that other doctors have mentioned. First of all, what is a uterine myoma?
Uterine myoma, sometimes in English we say fibroids, are actually abnormal growth of cells in the uterus. Now, the uterus is made up of muscle, and this muscle is called leiomyoma. If one cell in that uterus starts to grow fast, it can grow and become a tumor, and that tumor is called a myoma. So that's how myoma or fibroids occur.
So when you read about them, and sometimes they're called uterine myomas, benign tumors, it's the same thing as a fibroid, uterine fibroid?
Yeah. Myomas or fibroids are generally benign. About 99% of them are benign. Only a very small percent, in fact, 1% maybe, can become cancer. So generally, we say that myomas or fibroids are benign conditions. They are not cancerous conditions, but on rare occasions, it can become cancer.
What makes them become cancerous?
We don't know. In fact, we don't know why it becomes cancer, which fibroid become cancer. We don't understand that. And we also sometimes find it very difficult to diagnose a fibroid, whether it's benign or cancer.
What will be the process to diagnose if it is or it's not?
Generally, there is no fixed way of diagnosing a fibroid that has become cancer. The only way is to take out the fibroid and then send to the pathologist to check whether it is a benign or malignancy. But sometimes we can do an MRI, and an MRI may tell us some features that it looks like cancer. And a cancer of the myoma or fibroid is called leiomyosarcoma. That's the term that we use.
And why do women get them?
Nobody knows. Genetic, maybe. One of the theories is that in those days, women marry early and they have a lot of children. So they have less menses and their body has less hormone called estrogen in the body. And that's the reason why they never developed fibroids. Modern women, they marry late and they have very few children. So the amount of estrogen or hormones in the body is higher. So this fibroid develops. This is one theory. Another theory is that there is too much toxin in the environment, something called dioxin. So because of the presence of toxins, this kind of induces the development of fibroids. So these are the theories. But actually, we really don't know why fibroids or myoma occurs.
Are there different types of them? Or it's just if you get one, they're all the same, or is it different?
No, they are not all the same. When we look at fibroids or myomas, there are different types of fibroids. Some fibroids have got more blood supply towards it. We call them a vascular fibroid. Some fibroid has got degeneration. That means they are dying and they can become watery. Sometimes they can become cellular type, myxoid type of fibroids. So different types of fibroids, basically depending on the consistency of the contents of the fibroids.
Can you tell that by a scan, or do you have to do a biopsy to know what type of myoma you're dealing with?
Yeah, generally, when we do ultrasound, it's sometimes very difficult to see the different types of fibroids. An MRI can show us a lot of things. So we generally do an MRI. If we do an MRI, then we can predict whether the fibroid is a normal type of fibroid or has undergone degeneration or has some vascularity in it.
Depending on what type it is, it's the treatment, or you treat them all the same?
Previously, before the new technology called HIFU has come in, we will look at the fibroids. If the fibroids are not big, they are small, and if they don't give any symptoms, they're asymptomatic fibroids. That means they don't cause any heavy menses, they don't cause pressure symptoms, then we leave them alone. We just monitor them, say every 6 months or 1 year, we follow them up to see whether it's growing. Many of the fibroids can be small and remain small throughout their life. But if they start growing bigger and if they start causing problems like bleeding or pain or causing pressure symptoms like always want to pass urine, then we will need to consider some kind of intervention. The commonest intervention that we used to do is a surgery, what we call as myomectomy, where we cut the uterus, we take up the fibroid, and then we stitch the uterus back. Or if the patient is on the older side, she has finished her family, she has got completed her family, and she's, say, more than 45 years or nearly 50 years of age, then we do hysterectomy, we remove the uterus. So this is the traditional way of treating fibroids.
That was another question I was going. It's in a specific age group that women get them, or what age is it common?
We used to see fibroids in the older age group those days. I mean, 35, 40, 45, this kind of age group. But now I'm seeing younger and younger women with fibroids. I saw a patient 20 years old with a huge fibroid. So we don't know why it is now occurring more and more in the younger age group. So generally, women who do not have children develop these fibroids, and they are the ones who are most vulnerable to develop fibroids. And so if they're single or they're married but with no children, they have a higher tendency of developing fibroids.
What's the common symptoms? How does a woman know that she has them?
Symptoms will actually depend on where the fibroid is located. Now, if the fibroid is located near the inner lining of the uterus, the inner lining of the uterus is called endometrium. So that fibroid, we call it a submucous fibroid. That means a fibroid is touching the endometrium or found into the endometrial cavity. And these fibroids, even if they are small, causes a lot of bleeding. The patient will have a lot of menses, and we discover this fast because when a patient has a lot of periods, they will come and see a doctor, and we do a scan, we can see the fibroids involving the endometrial lining. Then the other fibroids are found in the center of the uterus. We call them intramural fibroids. Now, these fibroids, when they start growing bigger, patient also have symptoms, and the symptoms is usually heavy menses. And sometimes patients will have what we call as pressure symptoms. And pressure symptoms means it depends on what it presses on. If it presses on the bladder, the patient will find that she has to go to the toilet very often to pass urine. Or if it presses on the rectum, then they may have problems with constipation and difficult to pass motion. Sometimes these fibroids can also press on the ureters. The ureters are tubes that run from the kidney to the bladder. It's a very important tube. It brings the urine from the kidney to the bladder. And if you press on these ureters, then the kidneys can get swollen up. They can get kidney pain. So these are the common symptoms. Very rarely the fibroid can what we call as degenerate, or it started to die and they can cause pain. Sometimes we have fibroids that are found on the surface of the uterus. That means outside the uterus. And this is called a subserous fibroid. It is found on top of the uterus. And sometimes the fibroid is attached to the uterus like a rope attached to the uterus. And this is called pedunculated fibroids. And these pedunculated fibroids can sometimes twist by itself and can cause pain. Generally, fibroid does not cause much pain unless they are in the center of the uterus trying to come out, or outside the uterus, as I call pedunculated fibroids that twist, then they can cause pain. So these are generally the symptoms.
Does it have anything to do with the HPV?
Now, HPV is a virus that has got nothing to do with fibroids. Now, HPV causes infection of the cervix, and it can lead to cancer of the cervix. So this has got nothing to do with the fibroid. So it is nothing to do with this. It's a different condition involving the cervix, yes.
Now that the woman has found the symptoms, and always, I'm guessing it's recommended that gynecologists should be visited yearly or every 6 months, and not only when women are pregnant, because some women don't go to the gynecologist unless they're pregnant. With a regular study, you can find that the woman has some fibroids, or do some tests, or what's the protocol there?
This is a big problem. When a woman gets married and she gets pregnant, she will see a gynecologist. She will see a doctor, and the doctor will do the examination. And then if there's a fibroid, they will find out. But many single women, if they are well, they got no problem, they never see a doctor. And when they come to find out that they have fibroids, and the fibroids can be very huge. I've seen fibroids as big as a watermelon, that big. Now, that is a big problem. And I'm trying to educate women that even if you are single, you should see someone, not necessarily a gynecologist. You can see a general practitioners who can just palpate, feel the abdomen, whether there's any fibroids, or you do a simple ultrasound and the fibroid can be discovered. The way to discover a fibroid is by, if you don't have an ultrasound, you do a digital examination of the uterus and feel whether the uterus is big and whether it is enlarged. But the best way now is, because everywhere there's ultrasound, you just do an abdominal ultrasound, you can pick up a fibroid.
Let's start on the treatments. The traditional treatments involve surgery, HIFU, or there's another like...
Yes. Now we are going to talk about the newer technology, which is what this podcast is all about. Now, previously, what we do is we take out the fibroid or we take out the uterus. But now we have new technologies that we can actually kill the fibroid and let it die and get absorbed. So that is a concept. What we want to do is the fibroid is there. It is not causing very much problem, but can we kill it by some method? And the method that I am now using is something called HIFU. HIFU stands for High Intensity Focused Ultrasound. Basically, what we are doing is we are taking ultrasound beam and we are focusing it into one point. And when you focus a beam ultrasound into one point, it can increase the temperature of that one point to 65 degrees to 100 degrees, and then we can kill the cells. So if we can kill the cells, it's just like if you take a magnifying glass and take a sunlight and put it on a leaf, the leaf gets burned because the sunlight is focused into one spot and then that spot gets killed. The same way, we can use a transducer and an instrument to focus the ultrasound into the fibroid and you can kill the cell. So in this way, we can actually kill the cells in the fibroid one by one area by one area, and then we can kill the whole fibroid. And once the fibroid is dead, the fibroid will not grow anymore, and then slowly it will get absorbed by the body. And that is what this technology is called as HIFU, High Intensity Focused Ultrasound.
That's great. And does it work for all fibroids?
It doesn't. That's why I was explaining to you that there are different types of fibroids. The fibroids that have got a lot of blood supply into it, if you call it a vascular fibroid, it might not work. Because I'm saying it might. Sometimes it works, sometimes it doesn't work. Because what happens is when we put a beam of ultrasound into the fibroid, the blood that is flowing into the fibroid will get taken away by the blood, the high blood flow. And so it doesn't get killed. So this is one group of fibroid that doesn't work. Another fibroid is fibroid that are wet. That means there's a lot of water in the fibroid, what we call as myxoid degeneration or cystic degeneration. When there's a lot of water, we know that water will not get burnt. You cannot burn water. So these are a group of fibroids that it doesn't work. But generally, about 80 to 90% of the fibroid, which are solid, it will work. So what we do is, how do we know whether a fibroid is vascular, cystic, or myxoid? We do an MRI. By ultrasound, it's very difficult to know what type of fibroids they are. So before we do HIFU, we always do an MRI and then look at the MRI scan, and that will give us a good idea of what type of fibroid is it, whether the fibroid will be able to be killed with HIFU.
If the woman has several fibroids, can you treat them at once or separate sessions? And how long does the session last?
Many women have many fibroids all over the place, and we can actually do in one session, one fibroid after another. It takes a long time. We will first do one fibroid, then we go to the other fibroid, and then the other fibroid, and then do all the fibroids. And generally, if it is one fibroid, say 5 centimeters, we can do it in 30 minutes, 30 to 45 minutes. But if it's many fibroids, then we have to go from one to another. So I have done for 6 hours. Surgery for 6 hours. So it will depend on the number of fibroids, the size of the fibroids, and then we do slowly one by one. But we can do most of the fibroids in one sitting. That means just do once. Unless it's too big, then we may have to do the fibroid 2 times.
How's the process? A patient gets to your clinic. Can you explain the whole process?
Yes. That's a good question. So, what we do is this. Sometimes patients from overseas, I've even done surgeries or HIFU patients from people from Canada, from America. So what we do is first is a consultation. If the consultation can come to my clinic, they will come to my clinic. They would have been diagnosed to have a fibroid by their own doctor, maybe their own gynecologist, and they say that, okay, I've got this 7 centimeter fibroid and I'm thinking about HIFU. So what I will tell them is, okay, we'll give you an appointment to see me, and on the same day, we'll arrange the MRI for them. Or if they can do the MRI in their own place, they can do the MRI and they send the MRI to me. I look at the MRI and see whether it's suitable to do HIFU or not. So when they come to me, I will take a history, I will examine them, I'll do an ultrasound, then I'll send them for the MRI. Once the MRI is done, I think that this can be done, HIFU can be done. then I would put them on the HIFU machine. We call it a simulation. We want to test to see whether this patient is suitable to do HIFU or not. So they will lie down on the HIFU machine, and they will lie down prone with their tummy open and on the machine. And then we will test to see whether they are suitable to do HIFU. Once I've tested, I use the machine and play around and see, okay, this is suitable for HIFU. Then we arrange another day for the HIFU to be done. So that's the process. And also the other process is once they fix the date, we cannot do the HIFU during their menses. So we must arrange for the time when patient is not having their menses. And also before they come to my hospital to do HIFU on a second visit, they will have to have some bowel preparation. And the bowel preparation will include 2 days of low residue diet. That means they will eat food without any fiber. And then 1 day they will be only drinking fluid. This is to clean the bowel so that we don't have a bowel that's full of feces. Then they will come today to admit, and then we will admit them and will give them medicine to clean the bowel. And then the next day we will do the HIFU. In some countries, like China, Hong Kong, they do it the same day. You actually can do it on the same day. You do all the bowel preparation, everything. If they come on a morning, then we can arrange to do the HIFU on the same day. In fact, we can do it as a day case as well. You can come in the morning, you do the HIFU, evening they can go back. But in my country, because of logistics and I'm too busy, we admit them a day before, we do the HIFU, and then we send them home.
When you said you do a test run on the HIFU, why do you do that? Why is that necessary?
Okay, the aim of doing what we use is simulation and testing is because we want to see a lot of things. We want to see, one of the biggest problem when we're doing HIFU is we don't want the bowel, which is the intestine, to come into the area where we are going to do the ablation. So we need to make sure that the patient's fibroid is in a position such that the bowel doesn't come in the area that I'm going to shoot the beam. So there's a reason why simulation is important. Just looking at the MRI is not good enough. We need to test to see that this patient is suitable. Sometimes the fibroid may be too far behind and the HIFU beam cannot reach the fibroid. Sometimes it's in a difficult position. So these are tests that we need to do. We don't want to bring them in for the surgery and I can't do it. So that's the reason the simulation, a test, is very important to see that this patient is suitable to do HIFU.
And what's the biggest fibroid you have treated with HIFU and what was the recovery time?
Okay, we do fibroids up to a patient pregnant, like 5 months pregnant to even 6 months pregnant. So you can imagine 5 months pregnant means the uterus reaches the umbilicus. 6 months is just 1 to 2 centimeters above the umbilicus. These are big fibroids. They are 12 centimeters, 15 centimeters fibroids. And these are common fibroids that we do, even single or multiple. But the biggest that I have done is a person who is like a pregnant full term. That means she's pregnant like 40 weeks of pregnancy. And the fibroid was 30 centimeters. But this is one rare case that the patient is refusing to do surgery. So we had to do the HIFU almost 3 times to kill it. So the success rate, if you choose a fibroid that is, say, about 5 months pregnant, if we get the ablation done properly, in time, it will become smaller. Now, how do we know that the fibroid has been killed? That might be a question that you want to know. So we do an MRI before the HIFU. And when we do the MRI, we actually give them something called contrast. Contrast means it is a medicine that will see the blood flow in the fibroid. So it will look white because there's blood flowing inside. So after HIFU, when we do the same contrast MRI, the fibroid will look black. If the fibroid looks black, then we know that blood is not going into the fibroid and the fibroid is dead. So we use a word called NPV. NPV stands for non-perfusion volume. That means how much of the fibroid has been killed and how much has not been killed. The part that is black is the fibroid that has been killed. The part that is not black is the fibroid that has not been killed. So we want an NPV ratio of about 80 to about 90%, if possible even 100%. That means you want to kill everything if possible, but sometimes everything is impossible. So if you reach about 80 to 90%, they are quite happy.
I'm still in shock. So you can do that with a woman is pregnant?
No. I'm not saying she's not pregnant. What I'm trying to say is we actually measure the size of a fibroid like a patient who is pregnant.
Okay.
You understand what I mean? Okay.
Yeah.
So when we doctors, we gynecologists, when we tell how big is your the uterus, we tell them that it is like as though she is 5 months pregnant. You understand what I mean?
Okay.
That is
Yes.
no, we are not doing HIFU when the patient is pregnant, but we are saying that the
Okay.
fibroid is as big as a patient who is 5 months pregnant.
When you were saying pregnant, and she was like, and I was like, what? You were worrying about the colon and you're not worried about the baby. So good to know. And on those cases, the one that you mentioned, because you're all the way there, we're all the way. Watermelons are like this size, like the size of my head. So you have treated myomas that size.
Yes. That's about 9 to 10 centimeters. Yes, 9, 10, maybe 11 centimeters. An average fibroid that I do almost a few times a week. So fibroids grow to that big.
I can believe that it's like a pregnancy. Wow. That was like amazing to hear. But again, and I don't know if this is off topic or not, but how does a woman let it get that far?
Yes. You will be very surprised. You will be very surprised that many women think that they are fat. And they think my tummy is big, but actually I think it's fat, and didn't realize that they have such a big fibroid. So because it is growing slowly over the years. It doesn't just pop up. You know what I mean? When it grows slowly, you don't realize that it is growing. So it starts from a small. It is growing every day, and over years it grows big. It doesn't grow overnight. It takes years to become that big. So this is the problem that we face, that many women don't see a doctor, and then when they find out that they have these fibroids, they are really huge fibroids.
Wow. And they always thought they were overweight or just have a belly, right. And it turns out that it was like a huge fibroid.
Yes.
Wow. How long have you been using HIFU for, doctor?
I started it in July 2021. So we will be, actually I just crossed 3 years actually. So we have done almost 600 cases. Most of them are fibroids. Many of them are fibroids and also adenomyosis.
Have you heard any negative feedback regarding this HIFU?
Yes. I need to tell that everything in life has got its plus point and its negative points. So HIFU has got its complications as well. When we do surgery, we can have complications. We can have bleeding. We can have, sometimes we want to go and take out a fibroid, but she bleeds a lot. We have to take out the uterus. So it's got its own complication. Now, HIFU has got 3 major complications. The first complication is skin burn. Because when we shoot the beam from this, we are going through the skin. We are not cutting anything in the abdomen. We're just going through the skin into the fibroid and then burning the fibroid. So sometimes energy can get accumulated in the skin and you can get skin burn. So when we do this HIFU, the patient is actually lying on an area where there's cold water. So the cold water will keep the skin not hot. So in this way, we will keep the chances of skin burn to be very low. The second complication is something called nerve injury. Now, when we shoot a beam into the fibroid, sometimes the energy can go and hit the nerves which is behind the uterus, which is near the pelvis. So here again, when we do HIFU, we are doing it under sedation. We are not doing it under general anesthesia. That means the patient is actually awake and she's talking to us. And we'll keep asking her whether she has any pain in the legs. If she has any pain in the legs, then we would stop the treatment to reduce the chances of nerve injury. The third, which is the most dangerous one, is the bowel injury that I was talking to about. If the bowel comes in the way and we shoot the bowel can get injured and we can have a perforation. That means there's a hole in the bowel, and that can be very dangerous. That's the reason why we always make sure that the bowel is pushed away. We have got several ways to push the bowel away. So these are the 3 major complications, but the complications are very, very rare. It's very rare. It's even rarer than when you do surgery.
Is this technology available in the United States and Canada? You mentioned that people fly all the way there to get treated.
It is not. It is not available in Canada and United States. I think it's available in Mexico. Now, you must understand there are actually 2 types of HIFU machines. The first type is called the MRI HIFU. That means the HIFU is done in an MRI machine, magnetic resonance imaging machine. That machine is available in US, Canada, and all over the world. The one that I'm using is called an ultrasound-based HIFU, which is actually do the HIFU under ultrasound guidance. That means we're doing an ultrasound and then we are doing the HIFU. The difference between these two, MRI HIFU is not very good for fibroids. There are several reasons why it is not very good, because it takes time to do it. It is very cumbersome. Its energy is not very good. And that's the reason why we have converted to ultrasound-based HIFU, which is more real time. Real time means I'm looking at the fibroid as I'm burning it. So that is the advantage. And also, it's a much more powerful machine. So this machine is actually made in China. The top machine is made in China, and China has been using it for some time, and now they are exporting it to other countries. Korea has been using it for 10 years. Taiwan has been using it for 10 years. We only started 3 years ago in Malaysia. So there is a difference, and it has not actually gone to the West yet. It is not available in Canada. It's not available in the United States. In Europe, it is available in several countries like UK, in Oxford, but still more on a research basis and not in a regular basis yet. So they are working very hard to slowly bring the technology to the West.
Thank you very much. Is there anything that you think you would like to add to our conversation?
What I wanted to say is there's one other disease that we didn't discuss here. We only talk about fibroids. There's another disease we call as adenomyosis. I don't want to confuse women who are listening to this, but sometimes people mix up fibroid with a condition called adenomyosis. Now, adenomyosis is a disease different from fibroid, but it also causes a lot of bleeding. It also causes a lot of pain. And this is a disease where the inner lining of the uterus, which is called the endometrium, goes into the uterus and swells up the uterus. So that is called adenomyosis. So it's important for women to make sure that they don't have adenomyosis as opposed to fibroid. Because fibroids is actually an easier condition. You can even do a surgery to remove the fibroid. Adenomyosis, you can't. Most of the time, you may have to remove the uterus. And we can actually treat HIFU, and we can treat adenomyosis using HIFU as well. And I do a fair bit of this kind of patient. So it is important for women to find out the large uterus they have is actually a myoma or fibroid or an adenomyosis. I think that this is something that probably they would like to know.
I'm glad you mentioned that, because we have another episode and we're going to talk about exactly that, how to treat that and what's the procedure. And actually, we're having that episode in English also. So stay tuned. When we post this episode, we're going to leave the link to the other one so you can see how this, I don't want to say new technology, because I've heard that it's been around for like 80 years, something like that. It's not new, but
the technology is not new, but it is the way they do it is a little bit new. So the technology has been here for a long, long time, but it's just that it's now only being promoted all over the world. Yes.
Okay, that's good to know. Thank you very much, Dr. Selva, for your time. And to the audience, thank you for listening. If you have any questions for Dr. Selva, please leave it on the comments and we'll make sure to send them to him and get back to you with all your questions. Thank you for your time, Doctor.
Thank you. Thank you for inviting me to talk on this topic.
After talking to Dr. Selva, my takeaway is that visits to the OBGYN are not specific to pregnant women, and regular visits to the gynecologist can help detect future health issues. Medical tourism is an affordable way to get the help you need. I'll leave the link below to another episode where we talk to a gynecologist regarding another common health issue. The interview is in Spanish, but it has subtitles. Hope you enjoy it. If you would like to hear more episodes in English, please let us know so we can start working on them. Thank you.